That last video got a couple minutes longer, so this one will be a little shorter. Now remember, I keep putting them in smaller hunks. I could have done this in one long lecture, but I think you want to be, you think in smaller hunks. We all do. And remember, you can always speed up these videos too. So next thing I want to talk about is healthcare. Especially in the COVID world, things are changing so rapidly. We started with regular COVID, then we went to Delta, now we're in Omicron. Who knows what's coming? But the healthcare, the Affordable Care Act, has really benefited this period of time. Healthcare moved to a more preventive model and lower cost model instead of people going to the emergency room when they have troubles. Now that's worked. We now have the emergency rooms in the hospitals filled up with COVID patients. The other thing that did, and this is keeping the process moving, is there's standardized coverage definitions. In the past, every policy was different. It covered different things. You couldn't compare. Now you can compare. Adult children were covered till 26. In the past, you would have had to have your own insurance policy and paid for it. You can't be denied coverage because of pre-existing conditions, which could be COVID, long-term COVID. So what's the future? That healthcare is on top of mind of everybody. And when we look at 10% of the population is 30 million, and this is where people get their insurance. The employer, Medicare, and Medicaid. Medicare is for those over 65. Medicaid are for those of lower income, and Obamacare is roughly about 7.2%. And we have about still 8% of the population who has no health care. So when they're sick, they go to the emergency room, and the emergency room has to treat them. But the hospital's not getting any money for that. So the quicker they get them out of the hospital, the better. When we look at spending, the United States spends a whopping $10,340 per person. And if you look at the other developed countries, you can see we are the best, the highest, compared to average of 5 million or 5,169. So now we think about this. $10,000. So you would expect the outcomes to be better. If we take a look at these, we find that life expectancy at birth, 2013, as of now, it's actually gone down. The U.S. is the lowest. Infant mortality, we're a developed country, 6.1 versus 3.5. Percentage of the population with 2 or more chronic conditions, 68% of Americans. Look at the others. Obesity, 35.3 versus 28.3. Daily smokers, hey, we're better than that. But the percent of the population over 65, an indicator of health. So even though we pay the most per capita, we have the worst outcomes. We also have some of the highest maternal mortality rates. This is like, wait a minute, we're spending all this money, but yet more people die in the U.S. from live birth than almost any other developed country. We're not even close. I mean, if we look at France, 8.7, we're double. The other thing is, if we look, the number of people who saying their behavioral health is excellent has declined. Look at the prevalence of opiate use by country. The U.S., we have over 6% of the population actually using opiates on a regular basis. Other countries around the world don't have that. So chemical dependency is becoming a bigger issue. Well, we have a lot of different areas that there's policy in. Environment and education, transportation, safety, consumer protection and fight, agriculture, immigration. Now, don't forget the date here, but these are all things that policy impacts. There's regulatory, and we're seeing that around the environmental issues, safety, workplace safety. We're looking at long-term impact of these things. How do these policies and how do these macro trends, the economic situation, impact you personally? Best I said it before, jobs. Predict jobs that will be in demand over the next 10 to 20 years to help you focus on what you need to do to be successful. Focus your skills development, the ability to support oneself and family. quality of life issues, ability to create wealth, planning for the future. Let's look at financial statement analysis. The value of a company is its ability to generate cash in the future. The more cash they can generate, the more valuable they are. But it starts with growing sales. How will they do it? And what's the relationship between that and megatrends and current economic conditions and policies? That's why this is important to understand this, so we can understand what the future is. Analyze their sales within these contexts. Organizational behavior. How will a company run? How will it handle its human resources? How will the firm be able to successfully produce the product to generate the cash flow? Putting it all together, multiple variables, risk, there's unknown. But if you have a growth mindset, and that's something it's easier to say, but we engage in the right strategies, we think, we will come out better. You will come out better, I will. So have hope. This too shall pass.